Ferdinand Thomas, Counseling 510, video discussion thread, solution focused brief theory or narrative theory. So the first question is, what are the goals with this client when applying a solution focused brief therapy approach? And then for part one, it's also what are the goals when applying a narrative therapy approach? So I'm going to start with solution focused brief therapy approach. So for that approach, we would need Olivia to do something different. She would need to kind of not really direct herself, but direct herself to do something different. And obviously, the counselor would guide her and would encourage her along the way. Um, and then we would also and this behavior change would be preferably positive. That's a really important part, according to Corey 2021. We would also be trying to get Olivia, or the goals would be for Olivia to become the expert of her life. Um, for the counselor and Olivia to co-develop a unique and significant solutions, and for Olivia to choose the goals, and for the counselor obviously to guide. And those goals should be small, realistic, and achievable. For narrative therapy, the goals for Olivia would be identifying the problem, connecting oppressive intentions, and investigating the effects. Um, and the counselor would guide Olivia on a visualization process of the client seeing themselves as competent. Corey 2021. All right, so question number two. What would be the role of the counselor and the role of the client from the solution focused brief therapy perspective? All right, so from solution focused brief therapy, um, the counselor will be focused on helping the client shape goals, keeping emphasis on client strengths, goals, and change behavior, providing feedback with encouragement. Corey 2021. Choose appropriate therapeutic technique and probe with questions. Right. So the questions would be the pre-therapy change question, exception question, the miracle question, scaling questions. Then the counselor's role would also be to help shape and guide homework. As in solution focused brief therapy, homework is important, because we're focused on changing behavior. And then also to help the client develop their inner wisdom, their forgotten wisdom. Now, for narrative therapy, we're going to listen. The counselor is going to listen intently to the client's story with empathy and a not knowing attitude. Core 2021, and then also to help client identify the problem, understand oppressive behaviors associated, and find a solution. Core 2021. Also to be a non-judgmental supporter, and then for question three, what interventions, techniques, procedures might be helpful for this client from a solution focused brief therapy approach? And then what about from a narrative therapy approach? Externalization would be a beneficial technique with Olivia. Separating herself from her problems may be a pathway to healing, or it may help her to see the pathway to healing. Core 2021. I would also say that future forecasting can be helpful for visualization purposes. Looking into the future, especially looking into a future that has no problems, or none of the current problems that she's dealing with. It may open up a pathway to see how to actually get there. All right. So question number four. How would you integrate a biblical perspective with this client when applying a solution focused brief therapy approach? What about with the narrative therapy approach? How are these theories compatible with a biblical worldview when applied to this client? Well, Since affirmations are a part of the approach in solution focused brief therapy, Hebrews 11 and 1 is my biblical principle. Faith is the substance of things hoped for and the evidence of things not seen. Powerful, powerful verse. And it's focused on, in my opinion, is very similar to the picture that we see on the wall at a lot of different institutions. Well, it'll be a picture of Yeshua, and he'll have this big old giant, real cool looking teddy bear behind his back, right? And then he'll have this little girl in front of him. And the little girl, she's holding a teddy bear too, but her teddy bear is ugly. And it's the eyeballs is falling off. The little buttons for the eyeballs, they falling off. The stuffing is coming out and all that. It looks terrible. But she loves this teddy bear. You could tell by the way she holds it. Uh, but if she wants the teddy bear that's behind Yeshua's back, she has to have faith that something better is going to come, because she has to give away the teddy bear that she loves before she'll even know that there's a teddy bear for her that's behind his back, right? So this is a great analogy, in my opinion, for Hebrews 11 and 1. Faith is the substance of things hoped for and the evidence of things not seen. But when we think about Olivia and we think about what biblical perspective can be applied to help her through these challenges she's facing, well, in my opinion, it's faith. I mean, obviously, she does need to strategize. She does need to plan. She does need to do some things that she needs to do. But yeah, you gotta have faith, and you gotta follow through on what you have faith in, right? So let's go back to what I wrote. Since affirmations are a part of the approach in solution focused brief therapy, Hebrews 11 and 1 is my biblical principle. 2022. This verse, faith applied or not applied. But in this case, the client and counselors both will be applying faith to an end of change behavior. And I see that. I see how the client has to trust in the counselor, and how the counselor is putting a certain amount of trust in the client. Well, that's faith. Nobody knows the exact outcome. They're believing that they're going to move each other to that desired outcome. Well, that's faith. Hebrews 11 and 1. All right, so Hebrews 11 and 1 for narrative therapy as well. Faith is a huge component for the therapist. They must believe the person is not the problem. They must see the good and communicate the good in the client. Well, having faith will help to see the good in someone or the good in something. All right. Question number 5. If you had to choose between the two theories, which one would fit better the needs of this client? Which one are you more comfortable with? Explain briefly. Solution focused brief therapy would be the better fit for Olivia. Although it would be good for her to experience narrative therapy, Olivia is dealing with so much stress that behavior changes would be better for her in the first stage of recovery, because it offers hope and focuses on the client's strengths. Switzer and Rubin, 2015. Thereafter, Olivia could engage in a different therapeutic approach, helping her discover and process possible trauma perspectives of her past. That's Olivia is dealing with a lot of challenges right now. Like her stress levels got to be heavy. And you got some people who can see through the fog and be able to see their past. And they can see through all this stuff that's happening to them right now. You got some people who can do that. Then there's a lot of other people who they're not that good at that. So we're not really sure whether Olivia is good at that. But without us knowing whether she's good at that or not, I think that the solution focused brief therapy will help her. And because what it's focused on is getting results in behavior, getting behavior changes now. And for what Olivia's got going on, especially if she'd like to hold on to her children because of the custody battle, she's going to have to make behavior changes right now. So that is our video discussion for Counseling 510. I'm Ferdinand Thomas. Thank you very much.